Is there anyone out there who still isn't clear about what doing drugs does? Okay, last time. This is your brain. This is drugs. This is your brain on drugs. Any questions?
We always have to include just a touch of jackass into a serious topic.
Yes, we do, but street drugs are a big problem in Vancouver. It's no joke. We keep on hearing about kids partying and dying from ecstasy overdoses. And here to talk about that and a whole lot more is Dr. Duncan. How are you?
Very well. Nice
GP.
to see you. Happy New Year. I think
Happy
I can
New Year.
still slip that in.
You can.
Yeah,
now,
still, till the end of January. You got another week to get that in.
so ecstasy, first of all, what is it and why do people take it?
Well, ecstasy's got a long name, MDMA. It's methylene dioxymethamphetamine, and it's a form of amphetamine. I was reading about it actually last night. It was first made in 1912 in Germany.
I didn't know that.
It's been around for a long time.
Yeah. And obviously was not intended for casual drug use.
For casual use. They were thinking about using it as an appetite suppressant. I guess there was a lot of obese people in Germany before World War I. I don't know. And
wars
it started
tend to take care of that kind of issue for the most part.
Pestilence, plague. So people take it because I guess it makes you feel good, right?
That's called
the
ecstasy.
love drug.
Well, now we
love
heard
drug.
about it. It goes through phases of being popular and not. It was really popular in the 90s in the rave scene, but you didn't hear as much about people dying. So what has changed? Because since the new year, we've heard about numbers of kids dying from taking ecstasy.
Yeah, well, I was reading about that, and 18 in the last 2 years, 5 since August. And I think part of the problem is there's another drug being slipped in called PMA, which is paramethoxymethamphetamine, and it's about 5 times as potent. And it also has a slower onset, so somebody might take a pill, not have any effect, so they take another one, and then all of a sudden it kicks in. And what these drugs do, it's called serotonergic syndrome. Like it cranks up your blood pressure, your heart rate, and your temperature. And it's really the hyperthermia, especially if you've been dancing all night and not drinking enough fluids.
Not hypothermia, hyperthermia.
So that means super hot.
Super hot. You're super hot.
Super hot.
And so basically you start having tremors, like seizures, your muscles start breaking down, and
Well, high fevers can be deathly, so...
Yeah.
I was going to ask, I mean, is there medical intervention at that stage?
It's just supportive treatment, like getting them to hospital, IV, cooling them down, giving them anti-seizure medication.
And of course, if everyone around you is high as a kite, then chances are you're going to have delayed attention to your medical issue as you go along.
And it's not like they're controlled substances, right? So if you think you're taking E, it could be laced with acid, Rohypnol, like all the other funky things.
And with kids, they might be scared to call 911, which is causing a huge problem. Call 911. Your friend might die, so call someone so you can get paramedics there and help them out.
And don't, drink anything you haven't opened yourself. Don't leave your drink unattended.
Well, that'll bring us to the roofies. We always hear about roofies in the press. What is a roofie?
Well, there's 2 drugs that are used for date rape. There's Rohypnol, which, roofie, and then GHB, which is gamma-hydroxybutyrate, which is, both of them are sedative. They kind of chill you out, so they're kind of nice because they make you relax, and they don't have any calories. So GHB is like, alcohol, except no calories. So
and are
that's
these used in a medical setting for?
No. Well, I mean, Rohypnol, I don't know if anybody uses it, but it is,
But same thing as ecstasy, probably. They have the roots in experimentation.
So people take GHB on purpose as a drug.
As a drug. So it's like alcohol, but without calories, right? But
is it another one that slipped into people's drinks, like Rohypnol?
That's one of the ones that slipped into drinks,
okay.
Because it knocks your, victim out, and then you can...
and there's no memory, there's no, that's what you keep hearing with these things. And is it traceable within the system after? Because that's the other thing that I've heard.
Yeah, they can pick it up.
Oh, so they can, okay. Now, there's all these different classifications of drugs, and we're sort of keeping everything to this idea of club drugs today. And these are the ones where, they all seem to cause really fairly extreme chemical reactions within your body.
Yeah, and I mean, I think the nastiest one really is crystal meth. Now, how much of that is used in club drugs, I don't know. But I mean, the numbers are pretty staggering. Like youth in Vancouver, about 35% have tried ecstasy, but 25% have tried meth.
Well,
like,
crystal
that is
meth,
a huge
I remember
number.
reading about it, is highly addictive.
What
Very,
makes it
very,
highly
very
addictive? Is it a serotonin?
Yeah, and it causes like a supernova release, and it causes like really nasty brain damage. Like it kills your nerve cells, you release all the serotonin, and then you get the wow factor. But it's like, you know, Swiss cheesing your brain.
Right.
So
Literally.
Literally. And then, you know, people start to get very paranoid. There's something called meth mites, where you think you have bugs under your skin.
They're
and
changing
you're
their brain chemistry, right?
Yeah.
How do you have this conversation? I mean, you have kids, I have kids. How do you explain this is there a way to explain it in an effective way to kids?
I've driven through the downtown east side more than a few times with my girls, sort of saying this is what happens. You know, we have oatmeal for breakfast. We don't fry eggs. But you know, like it's scary. I mean, that's what I worry about, and I really worry about with daughters, the date rape.
Yeah, well, and for parents to understand at least the basic chemistry involved in this, and to be able to communicate that to their kids, that
you know
you're
what's
altering.
Scary is that I got my 11-year-old, also Fiona. I said, "Can you Google how to make ecstasy?" There's over 4 million hits.
And part of the problem with
Yeah.
ecstasy is that they've made some of the ingredients illegal, taking them off the shelf, so they're replacing them with the other things, as you said.
Yeah, and then that can lead to
leading
chemical byproducts that aren't intended.
Now let's get back to the date rape drug for a moment, because I've had friends who have had this done to
I've
them.
had at least 2 patients.
Everybody does, which is absolutely terrible.
Yeah.
First of all, never leave your drink alone. Never take a drink from a stranger. But if you feel weird or your friend does, I mean, what can you do?
Well, I think you have to get out of that situation and
Call
get to a
911?
safe place. Yeah, call 911, go to the emergency, and again, all you can do for that is supportive therapy until it wears off.
So that's just making sure they're hydrated, everything else, but
and breathing, their airways supported, whatever.
Yeah. Crazy.
Well, Dr. Duncan, thank you so much.
Thanks, buddy.
Fun.
Fun. Stay off the drugs, kids.
Yes.
You know, sometimes you got to be serious about things.
We actually were very serious.
It's kind of fun.
I know.
Not bad. I like your shirt, though.
He likes your socks. You guys are having a bromance. We're going to take a break, and we'll be back
these
with
things?
more. Michael.
Oh, nothing.
Right after that.
Look how they match your shirt.
La-da-da.